So many times we do the first hour, and in the middle of the session, the person takes a big, deep breath, like they've been underwater for their whole life. And this is the first time they've really gotten a breath. So at that point, what happens is the blood becomes oxygenated like it's supposed to, and the brain starts getting fed oxygenated blood and cerebral spinal fluid and the nutrients in the blood. So a person feels a sense of awakening and a kind of tingling kind of energy that gets activated with that. So when you breathe, the ribs move up and down. They're supposed to move. On most people, they're stuck and they don't move. So that's one of the main points of first hour, is to get those ribs moving. When a person breathes, they need to rotate a little bit. They need to open, like Venetian blinds. When you open the blinds, they open. When you close the blinds, they close. So that's the detail about the intercostals. And the diaphragm, of course, you want to open that. You want to release any fascial impingements on that. You can't actually touch the diaphragm, but you can touch the very edge of it from underneath the rib cage. So it's not like you're touching the diaphragm and you're massaging it or something. It's just more like you're getting the very edge of it and you're sending the message up on through it, and you're getting that diaphragm to pop open again, and so the person can breathe.
Okay, I have a question. I have a client, and when I work on him, like his chest is not moving at all, like a block of pattern. Like, what I do in this situation?
Okay, well, no movement is a sign of atrophy, right? So when the tissue is atrophied, that means that it's hardened. That means that it's literally dying. So the main point about that is to start to liquefy the fascia. It doesn't matter how you do it. It just only matters that you do it. So in that situation, you have to meet the person where they're at. So you have to be able to work on many different levels. So if you meet someone and nothing's moving, that's just where you have to start from. So introduce your touch, go slowly, and wait for the tissue to connect with you. So that's the first thing, is you have to connect up with the tissue and understand its pain and its suffering, so that it trusts you, and so that it will give you permission to go ahead and go on in there and do your work. Because if the person doesn't give you permission, it's really hard to get in there. It's almost impossible.